अस्सलाम वालेकुम डियर स्टूडेंट्स। आज हम टॉपिक जिस पर बात करेंगे दैट वुड बी द मसल्स ऑफ लंबर स्पाइन। उसकी हम बायोमैकेनिक्स पर बात करेंगे। उसकी जो एक्शंस है उसकी फंक्शंस पर हम बात करेंगे कि कौन से मसल जो हैं क्या क्या काम करते हैं। कौन से मसल्स ऑफ द लंबर स्पाइन दे आर इन्वॉल्व एंड स्टेबिलिटी, एंड कौन से मसल्स जो है दे आर इन्वॉल्व काइनेटिकली, यानी एक्सटेंसर्स कौन से हैं। इसके अलावा फ्लेक्सर कौन से हैं, लेटरल बेंडर कौन से हैं। बिफोर गोइंग टू दैट बायोमेकेनिक्स ऑफ मसल्स, हम थोड़ी सी कुछ डिस्कशन करेंगे कि मसल्स के बेस पर के स्पेसिफिकली इस लंबर एरिया पे। तो लंबर एरिया की मसल जो हैं ये एक posteriorly they are bulk of muscles present on the both side of the spine, and these bulk of muscles on the back, this is known as the paraspinal muscles. ये जितने ये मसल जो हैं ऑन द बैक, दे आर नोन एज द पोस्टीरियर मसल्स। और फिर इसके फिर अगेन डीप एंड सुपरफिशियल इस तरह डिवाइड किया गया है। अब ये मसल जो हैं जैसी जैसी जो है हम सुपरफिशियल से डीप की तरफ जा रहे हैं, सो इसकी जो स्टेबिलिटी वाला फंक्शन है ये ज्यादा आ रहा है। और उसका जो डायनामिक फंक्शन या कोई जो इसकी काइनेटिक फंक्शन है, सपोज एक एक्सटेंसर है, तो जितना एक मसल जो है वो सुपरफिशियली आ रहा है वो उतनी ही जो है वो ज्यादा सपोज एक्सटेंसर होगा। और जितना ये डीपर होगा तो ये उतनी ही स्टेबिलिटी की तरफ जो इसकी फंक्शन जो है ज्यादा होगी। तो बायोमैकेनिक्स के लिए हम इसको इस तरह एक्सप्लेन कर सकते हैं कि मोमेंट आर्म जो है इनका कम होता है जो डीपर मसल्स होते हैं। तो बिकॉज ऑफ दैट शॉर्टर moment arm, these muscles that have difficulty to move the spine is a segmental level पर या is a global पूरी जो region है उसको move करने में, while those muscles who are they are present superficially, they have a long moment arm, so they can easily move the spine। जिस तरह की हम मल्टीफ्रेटस की बात कर ले या रोटेटर्स की बात कर ले, तो ये ज्यादातर जो है इन्वॉल्व होते हैं, दे आर डीपर, सो दे आर इन्वॉल्व इन स्टेबिलिटी। ऑन द अदर हैंड सुपरफिशियल fibers and muscles of the rectus spinae, they are involved in the extension of the back when they are contracting bilaterally। लेकिन इसी रेक्टस स्पाइनाई की जो डीपर मसल है फिर वो स्टेबिलिटी प्रोवाइड कर देते हैं। तो एक तो ये कंसेप्ट हो गया कि मोमेंट आर्म। अब मोमेंट आर्म क्या है? मोमेंट आर्म इज दैट हॉरिजॉन्टल डिस्टेंस बिटवीन दैट इंस्टेंट एक्सिस ऑफ रोटेशन, इंस्टेंट जो आई आई आर होता है विच इज प्रेजेंट एट द लंबर एरिया में, ये पोस्टीरियर वन तरफ दैट डिस्क एंड बॉडी जो है उस पर प्रेजेंट होती है। वहां से ये डिस्टेंस परपेंडिकुलर टू द लाइन ऑफ पुल जो है उसकी, तो ये जितना डिस्टेंस होता है that is known as the moment arm. So higher the moment arm, easy for the muscle to move that region in any direction. Secondly, कुछ मसल जो है जितनी verticals होंगी they will be more involved in the extension when they are contracting bilaterally, and the muscles which are more in horizontal, so they will be involved in the rotation of the lumbar spine। जिस तरह के हम अगर हम देखें जो मल्टीफेडाई मसल है, ये दे आर मोर वर्टिकल in the lumbar region as compared to the thoracic spine. So यही multifidus when they are in thoracic spine, so their stability के साथ साथ their work is rotated for the thoracic spine, but in the lumbar region stability के साथ साथ जो है ये segmental extensor होते हैं। So because they are more vertical than the, तो जितना ज्यादा verticality होगी उतनी ही ज्यादा जो है they will be involved in the extension of that back जो posterior muscles है। एंड इफ दे आर मोर ओब्लिक, जितना ओब्लिक से ये हॉरिजॉन्टल की तरफ जाएंगे, सो मोर दे विल बी इन्वॉल्व्ड इन द रोटेशन ऑफ द लंबर स्पाइन। तो हम पहले क्लासिफिकेशन पर बात करेंगे कि जो लंबर स्पाइन जो है या लंबर एरिया जो है इसकी जो मसल्स है उसको हम कितने रीजन्स में डिवाइड करते हैं, सो उस पर बात कर देते हैं। सही। जी, हमने थोड़ी डिस्कशन भी की है कि जो मसल्स हैं थोरेसिक और लंबर एरिया की, ये हमारी न सिर्फ मूवमेंट काज करते हैं, बल्कि ये हमारे मूवमेंट्स को स्टेबलाइज भी करती हैं। एंड सम मसल्स दे आर इन्वॉल्व टू स्टेबलाइज द स्पाइन व्हाइल वी आर मूविंग, व्हाइल सम मसल्स जो हैं ये दे आर द प्राइम मूवर्स, दे आर एक्चुअली रिस्पॉन्सिबल फॉर दैट मूवमेंट। तो ये जो है दोनों उस एरिया को स्टेबलाइज करने में भी एक की रोल अदा कर देते हैं, और उस एरिया की जो एक्सटेंशन होती है, फ्लेक्शन होती है, रोटेशन होती है, लेटरल बेंडिंग होती है, ये भी जो है ये मसल जो है मुख्तलिफ मसल इसमें इन्वॉल्व होते हैं। So these three जितनी muscles है, these are divided into three categories: the posterior muscles, the lateral muscles and anterior muscles। हम एक एक को डिस्कस करेंगे। तो सबसे पहले हम डिस्कस करेंगे posterior muscle को। जो अभी जिस डिस्कशन हमने की, that was about this posterior muscle। Posterior muscles जो है again they are divided into two groups, that is the superficial and the deep muscles. Yeah, we can say that the superficial posterior muscle and the deep posterior muscle। फिर जो ये सुपरफिशियल पोस्टीरियर मसल्स है, सो ये दो स्ट्रक्चर्स उसमें आते हैं। एक उसमें सबसे जो सुपरफिशियल स्ट्रक्चर है इन द लंबर, ये दिस इज दैट fascia of the thoracolumbar, which is the aponeurosis between the tendons, between the muscles of that lumbar region, below the lumbar region जो यहाँ पे है, और and above that lumbar region। तो इनकी जो एक डायमंड शेप बनती है उनकी एपिनोरोसिस की, तो यही जो है इसको हम इसमें सुपरफिशियल आती हैं। तो दिस फिशिया जो है thoracolumbar फिशिया, ये एक्चुअली एक फिशिया होती हैं जो मुख्तलिफ मसल्स जो है एक दूसरे से उसको सेपरेट कर देते हैं। दैट इज वी कैन से दैट इज दैट इंटरमस्कुलर फिशिया, यानी एक मसल और दूसरे मसल के दरमियान जो एक टिश्यू होती है, दैट इज एक्चुअली नोन एज द फेशिया। तो ये स्ट्रक्चर जो है पोस्टीरियर thoracolumbar fascia, that is actually that intermuscular fascia which is present between the different muscles of the posterior back muscles, the lateral back muscles, as well as the anterior back muscles, जो अभी हम आगे डिस्कस करेंगे। अच्छा, यहाँ पे कुछ एक जिसे हम कंट्रोलेटर स्लिंग भी कहते हैं, ये कपल एक्शन होती हैं इन द लंबर रीजन। दैट इज द कंट्रोलेटर मसल्स इन्वॉल्व होते हैं इन अ ग्रुप एक्टिविटी। एंड दैट इज सपोज अगर राइट साइड का जो लेटिसिमस डॉर्साई होता है, सो ये इसका कपल एक्शन जो होगा कंट्रोलेटर साइड, जो ग्लूटियल मीडियस जो है उनके साथ होता है। तो ये जो मसल्स होते हैं ये क्या करते हैं, दे वर्क टुगेदर टू हैव एन एक्टिविटी। जिस तरह की मुख्तलिफ ट्विस्टिंग मूवमेंट्स होती हैं, रोटेटरी मूवमेंट्स होती हैं, गाल्ब खेलने में जो, चूंकि हमारे एक एक तरफ अगर हम बेंड होते हैं तो दूसरी तरफ हमारी बैक जो है रोटेट होती है। तो ये तमाम जो है यहाँ पे ग्लूटियाई मसल्स और लेटिसिमा डॉर्साई के दरमियान जो है एक कपल एक्शन होती है। और ये लेटिसिमा डॉर्साई और ग्लूटियाई मसल्स जो है एक दूसरे के साथ जो कनेक्ट होते हैं, दैट इज थ्रू दैट thoracolumbar fascia। तो during those moments when we are going to rotate the lumbar spine, we are going to extend the lumbar spine या bend the lumbar spine, यही मसल जो है ये कंट्रोलेटर स्लिंग जो है ये इस एरिया को स्टेबिलिटी भी प्रोवाइड कर देती है। सो ये posterior sling जो है, that is latissimus dorsi and the gluteus maximus muscles, ये contralateral side का। If suppose if this is the left side of the latissimus dorsi, so that is the right side gluteus maximus, and they are connected to this fascia which is the TLF। So ये जो है इसको कहते हैं posterior muscle sling। So the gluteus maximus and the latissimus dorsi, they work together, they have a couple action which will work together for that moment which we required during the that even hitting a shot, hitting a ball in the cricket game, yeah, when we are going to swing that ball, golf swing in the other sports। तो रेंगुलर नंबर फिशल लेयर जो है ये फिर तीन लेयर्स में डिवाइड होती हैं। दिस इज द पोस्टीरियर, मिडल एंड इंटीरियर। जिस तरह हमने स्टार्ट में कहा कि ये एक्चुअली फिशर जो है thoracolumbar TLF जो है ये मुख्तलिफ मसल्स के दरमियान जो है एक सिप्टम के तौर पर काम करती हैं, एक लेयर के तौर पर काम करती है, जो एक मसल को दूसरी मसल से सेपरेट कर देती हैं। तो इसका जो पोस्टीरियर लेयर है, ये पोस्टीरियर लेयर कंसिस्ट ऑफ टू लेमिनाई विच इज द सुपरफिशियल एंड द डीप लेमिना। थोड़ा सा अगर हम इसके डायग्राम पे जाए तो दैट विल बी मच मोर क्लियर। यहाँ पे अब हम देख सकते हैं कि व्हाइट लाइन जितनी भी हमें नजर आ रही हैं, दीज आर एक्चुअली द टीएलएफ, और इसका ये इंटीरियर लेयर है, दिस वन, दिस इज द मिडिल लेयर एंड दिस इज द पोस्टीरियर लेयर। अब ये पोस्टीरियर लेयर जो है, दिस इज एट द बैक, दिस इज द मोस्ट सुपरफिशियल स्ट्रक्चर ऑफ दोस मसल्स। सो यहाँ पे हमने स्टार्ट स्लाइड में कहा कि टीएलएफ इज द मोस्ट सुपरफिशियल। तो मोस्ट स्पेसिफिक अगर हम बात करें तो टीएलएफ का जो पोस्टीरियर लेयर है, दिस इज द मोस्ट सुपरफिशियल स्ट्रक्चर ऑफ द लंबर मसल्स। फिर उसके बाद जो मिडिल लेयर है, मिडिल लेयर इज प्रेजेंट बिटवीन द इरेक्टर स्पाइनाई मसल्स एंड द quadratus lumborum muscles. This is the quadratus lumborum muscles, which is actually the lateral muscle, जो एक lateral bending करा देती है when it is contracted unilaterally. And then this is interior layer. Interior layer is present between the psoas major muscles, which is a member of the interior muscle, and the quadratus lumborum. So in three layers, they are known as the TLF, or the thoracolumbar fascia. So the middle layer passes between the paraspinal muscle. Paraspinal muscle mean that erector spinae, which includes the three muscles which are in the सही है, ओके मैं आई एम सॉरी फॉर दैट लिटिल डिस्टर्बेंस। अच्छा, तो हम बात कर रहे थे तो इसकी पैरास्पाइनल मसल की। तो पैरास्पाइनल मसल हमने स्टार्ट में स्लाइड में डिस्कस किया कि व्हाई दे आर नोन एज द पैरास्पाइनल मसल्स। पैरा मीन साइड एंड दे आर स्पाइन मीन ऑब्वियसली द स्पाइन, सो दे आर प्रेजेंट ऑन द बोथ साइड ऑफ द स्पाइन, दे आर नोन एज द पैरास्पाइनल मसल्स। पैरास्पाइनल मसल में जो बेसिकली मसल आते हैं, दे आर द इरेक्टर स्पाइनाई व्हिच आर अगेन ए ग्रुप ऑफ मसल्स। और हमने इसको इस तरह भी कर सकते रहते हैं कि जो तीन मसल है जो इसमें आते हैं, दैट इज द इलियोकास्टाइलिस, द लॉन्गिसिमस एंड द स्पाइनलिस मसल। द स्पाइनलिस मसल इज द मोस्ट medial member, then the longisimus is the longest as well as the middle member of this erector spinae, and the iliocostalis is the most lateral member of this erector spinae group. So ये जो तीन मसल है, iliocostalis है, longisimus है and spinalis है, इन तीनों को collectively जो है कहा जाता है the erector spinae muscles or the paraspinal muscles. पैरास्पाइनल मसल में डीप मसल फाइबर्स भी आते हैं, जो मल्टीफिडस है वो भी उसमें शामिल होती हैं। यानी ऑल दोज मसल्स, ईदर दे आर द ग्लोबल मसल, दे आर द सेगमेंटल मसल, बट दोज मसल्स व्हिच आर पोस्टीरियरली लोकेटेड एंड प्रेजेंट ऑन द बोथ साइड ऑफ द स्पाइन, दे आर नोन एज द पैरास्पाइनल मसल्स। तो लेकिन पैरास्पाइनल मसल में जो बड़े मसल्स है, दैट इज द तीन मसल जो अभी हमने बात की, इलियोकास्टाइलिस है, लॉन्गिसिमस स्पाइनलिस है, और बाकी जो छोटे मसल्स है उसमें से रोटेटर्स भी आते हैं, इनमें से मल्टीफिडस भी आते हैं, इसमें सीमी स्पाइनलिस भी आते हैं। तो ये तमाम जो है दे आर नोन एज द पैरास्पाइनल मसल्स. So the middle layer is present between the paraspinal muscle and the quadratus lumborum, while the interior layer that is present between the quadratus lumborum and the psoas major. Some text में ये है कि जो interior layer है, basically that is being considered as are the extension of the transversal fascia which is present between the abdominal muscles, which are also the interior lumbar muscles. Okay. So erector spinae muscles, as we discussed previously, these are the group of muscles. They are the longissimus, iliocostalis, and the spinalis. Spinalis is the most medial muscle, while iliocostalis is the most lateral muscles. And all of them, they have the same function. When they are contracted bilaterally, they are extending the lumbar spine. Each muscle having a lumbar portion called the pars lumborium and a thoracic portion called the pars thoracic. They are very complex. Just memorize these words: longissimus, iliocostalis, and spinalis. When they are present at the lumbar area, and their uh, superior attachment is on the thoracic region, so that is known as the pars thoracis. Those, when they are attached on thoracic inferiorly and superiorly they are attached on the cervical region, they are known as the pars cervicis. And when they are attached inferiorly on the cervical spine and superiorly they are attached at the skull, at the back of the skull, so they are known as the pars capitis. Just for example, longissimus capitis, longissimus cervicis, longissimus lumborum, longissimus thoracis. So this is the different parts of the muscles when they are attached. So these names, all these names which are the lumborium, thoracic, cervicis, they are given on the basis of their superior attachment. So the superficial layer, they run from the ribs and thoracic transverse process to form the bellies of these muscles, these three muscles. And these muscles have long tendons which join together to form the ESA, which attach into the spinous process of the lower lumbar spine, sacrum, and the iliac crest. ESA means erector spinae epineurosis. So these are those muscles. These are the erector spinae muscles. The most middle one is the spinalis. The second, the intermediate muscle, this is the longissimus, and the most lateral one is the iliocostalis. You can just memorize these muscles with the mnemonic I love the spine. So that is iliocostalis, longissimus, and the spinalis. अगर हम यहाँ पे लॉन्गिसिमस को कहाँ भी इससे जाता है कि दैट इज द लॉन्गेस्ट मसल ऑफ दिस मेंबर. अगर हम इसको देखें इलियोकास्टेलिस को, व्हिच इज इलियोकास्टेलिस, नाम से जाहिर है कि दीज have origin, they originated from the ilium, and superiorly they just go upward and then attach on the different ribs. So these are the iliocostalis, mean from the ilium to the ribs. Castal जो है that mean ribs, while the longissimus muscles, that is being originated from here, from the sacrum, and then it's going upward, and here it is attached to the just below the mastoid process of the skull. So that is actually the longissimus. After that, we have that spinalis. Spinalis is also attached to the back of the skull. So that is, but this muscle is being originated much above than this longissimus. So longissimus is the longest muscle of these three members. So here we have the different parts of this muscle: the spinalis cervicis, spinalis capitis. We have explained this कि cervicis जो है and capitis जो है, इसको हम इस बेस पर कहते हैं कि if they have superior attachment in the cervical, so they will be called as the cervicis. If they have superior attachment at the skull, so they will be called as the capitis. And if they have a superior attachment at the lumbar thoracic area, they will be known as the thoracis. And if they are present at the lumbar area while originating from the sacrum and the ilium, so they will be called as the lumborum. So that is different parts of these muscles. Collectively, these muscles are known as the erector spinae muscles, and all of them, they are working to extend the back, while it is the upper back, the middle back, or the lower back. Erector spinae superficial layer, they are present with long movement arm, which produce the extension of the thoracic and lumbar spine when contracted bilaterally, and are considered as the primary extensors. We have discussed them in detail in the previous slides. Acting unilaterally, they are able to laterally flex the spine and contribute to the rotation of the spine as well. That is very important. When these muscles, they are contracting bilaterally, it means the paraspinal muscle on the right side and paraspinal muscle on the left side. When on the both sides, the muscles are simultaneously contracted, so they will extend the back. But if they are contracted only on one side while they are relaxing on the other side. So obviously, then they will laterally bend the spine. Sometimes they may also have some contribution in the rotation of the spine as well. During the trunk flexion, from standing the erector spinae, they are responsible for uh, contracting eccentrically to control the motion. They are in the relaxed position. During the friction, they are increasing in their length, which we call as the eccentric contraction. However, the extent and the rate of the friction is controlled partially by the eccentric contraction of the extensor, with the erector spinae epineuritis, and partially by the TLF, thoracolumbar fascia, and the posterior ligamentous system. From the posterior ligamentous system, we mean all those ligaments which are present in the posterior column, including uh, those supraspinal interspinous ligament, ligamentous flume, as well as we can also consider the middle column ligament, which is actually the PLL, the posterior longitudinal ligament. So all these are known as the posterior ligamentous system. The erector spinae work eccentrically until the two-thirds of the maximal flexion has been attained, at point where the erector spinae become electrically silent at the last third of the flexion. So this is that movement arm for the which is enough to extend the back, and that's why the superficial layer of the erector spinae, they are responsible for the extension of the lumbar region. They are also known as the prime movers for this action, for this extension. There is the action of the deep layer of the erector spinae that is on the contrast to the superficial layer. The deep layer is entirely separated from the superficial layer and is consists of individual fasciculi with common tendinous insertions. The fascicles arise from the ilium at the posterior superior iliac spine and just lateral to the iliac crest, and course superiorly, then medially and anteriorly to insert on the lumbar transverse process. That is very important. It's actually the course and direction of these muscles when they are going upward. So not only upward, they are also going medially as well as they are moving from posterior to interior direction. These muscles lie close to the axis of rotation, uh, and therefore don't have that sufficient moment arm to be the prime moves for extension, and that's why they act as stabilizer for the lumbar spine. So the oblique orientation of the erector spinae exert a posterior shear force along with compressive forces, and these posterior shear forces that act in against of the interior shear forces. Due to orientation, they play a key role in resisting the interior shear forces and gives stability. And friction at loose orientation and hence unable to resist interior shear forces and leads to damage. And that is that region, that is that instant where all the stability that is on the static stabilizer, which are the ligaments. And that's why it is recommended that when we are going to lift some weight from the floor, so we should bend our knees. We shouldn't bend our back, because if we are going to lift that weight with bending back, so at that we are increasing the demand on the region. We are in the stability as demand is increasing more and more. There will be no muscle involvement. The muscle are silent at that time, and all the stability there will be on the static stability on the ligament. So it is very recommended to bend our knees while we are going to lift some weight from the floor and standing position. These are the deep layer of the erector spinae muscles. They are much closer, so that's why they are just involved in producing that posterior shear forces, which actually resist the interior shear forces, and they have a key role in providing stability to this region. So these were the posterior muscle superficial discussion, superficial structures, which we include there are two structures in this category. One was the TLF, which was divided into three layers, the interior, middle, and posterior. We discussed that. And the other structure was the erector spinae muscles, which were again divided into the superficial and deep on the basis of its action. The superficial erector spinae, they are involved when contracted bilaterally in the extension of the back, while unilaterally they have contribution in the lateral bending and rotation as well. While the deep erector spinae muscles, they are involved in providing stability to the lumbar region. So the posterior deep muscles, the important muscle in this group, they are the multifidus muscle. Otherwise, there are three members of this posterior deep muscles. Among them, this is the semispinalis muscle. This is the most superficial one. Then this is the multifidus muscle, and then the smallest as well as the most horizontal of the lumbar spines of the posterior lumbar spine. They are the rotators. Uh, these muscles, they are originating from the transverse process, and then they move upward and attach on the spines process, and that's why these are known as the transverso spinalis group of muscles. So we can conclude that transverso spinalis group of muscles, they're actually the posterior deep muscle and consist of the semispinalis muscles, which are the largest muscle of this group. Multifidus muscles, they are the intermediate muscles. They are smaller than the semispinalis muscle, but they are larger than the rotator, while the rotator are the third member of the transverso spinalis group of muscles. And these are the smallest, not only of the transverso spinalis group of muscles, but these are the smallest muscle of are the lumbar muscles. So deep to the erector spinae is complex and have segmented and regional differences. Deep to the semispinalis and superficial to rotators, a number of muscles they are located, known as the multifidus muscles. Run generally from the dorsal sacrum and the ilium to the spinous process of the lumbar vertebra, and they are also present at the other upper region of the back as well. They also have separate vesicles which run from the mammillary process of the inferior vertebra to the spinous process of the that superior vertebra. Mammillary process, that is a process which is present on the transverse process. Other process which are present on the transverse process, they are the interior and posterior one. So they are originating from the transverse process, and then they are going upward to attach to the spinous process of the superior vertebra. The line apple is more vertically oriented in lumbar region, while this orientation is more horizontal in the thoracic region, as we discussed earlier, and that's why the function and action of the multifidus muscles is different in the lumbar region and in the thoracic region. In the lumbar region, they work as extensor, segmental extensors, while they are involved in somehow in the rotation of the that thoracic region, because of their more horizontal orientation than the lumbar region. Having greater cross-sectional area and more vertical orientation, it is best suited for extension by increasing lordosis and compression on posterior aspects of the intervertebral joints. And thoracic region, due to its orientation, they are best suited for the rotation. So these are the multifidus muscles. Here it is, these are the multifidus. They are just have inferior attachment on the transverse process, and then they move in oblique nature from that lateral to in the medial, in the superior and medial and in the interior direction, and attach to the spinous process of the superior vertebra. They are present. These are the separate physicals. This is multifidus. This is multifidus. So these are the different multifidus muscles which are present in the region thoracic and that lumbar. The posterior deep muscles, they are the intertransversari. Intertransversari are small muscles which are present. These are the intertransversari muscles. This is the transverse process. This is transverse process. The small muscle which is present between two consecutive transverse process is known as the intertransversari. And that is the plural is the intertransversari. While the rotators, they are again very small muscles horizontal muscles which are involved in the rotation of the that lumbar region. Now let's come to the next category. We have discussed the posterior muscles. Now come towards the lateral muscles. There is a single muscle in this group, and that is the quadratus lumborum. This quadratus lumborum that has inferior attachment on the iliac crest, and then they move superiorly as well as medially to attach to that transverse process of the lumbar spine as well as to that rib as well, which is actually the quadratus lumborum. They are present at the lumbar region and they are rectangular in shape. That's why this muscle is known as the quadratus lumborum. Deep to the erector spinae and multifidus muscle, when acting bilaterally, serve as frontal plane stabilizer. When acting unilaterally, the quadratus lumborum can laterally flex the lumbar spine. It means when the right side quadratus lumborum is contracted concentrically, so it will laterally flex the lumbar region into the right side, while there will be eccentric contraction on the left side. When there is contraction of the concentric contraction of the muscle and the quadratus lumborum on the left side, while there is relaxing and increasing in length eccentric contraction on the right side, so the back will be laterally bent towards the left side. During lateral flexion and standing, the gravity will facilitate the movement, while the contralateral quadratus lumborum will control the movement by contracting eccentrically. If the pelvis is free to move, so the quadratus lumborum will hike the hip or laterally tilt the pelvis in frontal plane. That means when that is closed kinetic chain or the open kinetic chain. Closed kinetic chain mean when both the limbs there are on the ground, and open kinetic chain when one limb is in the air. That will be known as the open kinetic chain. So that is the quadratus lumborum action. Now let's come towards the interior muscles. Here we have a number of muscles, specifically that is we have the abdominal muscles, which are 4 in number: the rectus abdominis, internal oblique, external oblique, and the transverse abdominis. These 4 muscles, they are collectively known as the abdominal muscles, while another member, the posterior member of the interior muscles, that is the psoas major muscle. So rectus abdominis, that is also a prime flexor for the lumbar region, just like the erector spinae superficial fibers, which are the prime extensor for the lumbar region. It is contained within abdominal fascia, which is there's white color in. These are the abdominal fascia. It separates the rectus abdominis into section. These are the sections which we call as the six pack. This is just because of the hypertrophy of these separate bulk area. So when they are hypertrophed, so they are just appearing as the different segments, which we call as the pecs. These attaches to the epineurosis of the abdominal wall. These are the interior muscles. We have 2 rectus abdominis muscles, which are being wrapped around an epineurosis. Then 3 muscles, which are the transverse abdominis is the most innermost muscle, while there are 2 muscles, the external oblique and the most lateral, and the middle muscle, which is in the internal oblique, and the psoas major muscles. So these 4 muscles, 5 muscles, the psoas major muscles, internal oblique, external oblique, transverse abdominis, and the rectus abdominis muscles. These are known as the interior muscles, while the quadratus lumborum, these 2 muscles, they are the quadratus lumborum on both sides. They are the muscles of the lateral lumbar muscles, while these muscles, which is actually the iliocostales, the longissimus, as well as the multifidus muscle in the innermost, these are the posterior muscles. External and internal oblique. External and internal oblique together with the transverse abdominis consists the abdominal wall and forming the hoop around the entire abdomen with the abdominal wall as the interior aspect while thoracolumbar fascia and its muscle attachment as the posterior aspects. This hoop plays an important role in the stability of the lumbosacral spine stability. This is the transverse abdominal muscles, which is the deepest muscle of all these three muscles. This is the transverse abdominis, then the internal oblique, and then the external oblique. If you look at the fibers of these muscles, external oblique, they are from medial to the lateral, while internal oblique, they are from lateral to the medial, while the fibers of the transverse abdominis, they are horizontal, while the fibers orientation of the rectus abdomen is straight. That's why it is known as the rectus abdominis. The word rectus means straight, and the abdominis means the straight muscle of that abdomen. We have another rectus muscle in the thigh, which is known as the rectus femoris, which means the straight muscle of the thigh. Transverse abdominis, which we discussed already in the previous slide, that is the deepest of all abdominal muscle. And they play a key role in the lumbosacral stability, and that's why they are also known as the weight belt muscle. They have that nickname, the weight belt. The transverse abdominis, due to its transverse orientation, mechanically control the movements of the sacroiliac joint through the significant compressive forces. Hence, they may be helpful in the SIJ exit. This is the posterior member of this interior muscle of the lumbar spine, psoas major muscle. Psoas major, a muscle that run from the lumbar transverse process, the anterolateral vertebral bodies of the T12 to L4, and the lumbar intervertebral disc to lesser trochanter of the femur, where it is attached and combined with the iliacus muscles. So if we talk about just simple the psoas major muscle, so psoas major is present superiorly at the lumbar region, but at the lower attachment, it combined with the tendon of the iliacus muscle. So, and the inferior attachment to the lesser trochanter, they are known as the iliopsoas muscle, while at the superior attachment, they are known as the psoas major, because the iliacus muscles that originate from the iliac fossa in the iliac, that iliacus muscle has nothing to do with the lumbar region. So that's why when we are discussing the muscle of the lumbar region, so we will discuss the psoas major. But if we are discussing the muscle of the hip joint, then we will term this muscle as the iliopsoas muscle, because at that area there are two tendons which are inserting together at the lesser trochanter. One is the psoas major, the other is the iliacus. Collectively, they are known as the iliopsoas muscle. It courses inferiorly and laterally, and distal tendon merge with that of the iliacus muscle, forming the iliopsoas muscle. The iliacus run from the iliacus toward the pubic ramus to the lesser trochanter with the tendon of the psoas major. The role of the psoas major at the lumbar spine appears to be to buttress the forces of the iliacus, which when activated cause interior iliac rotation and thus lumbar spine extension. Primary function of the psoas major muscle is to flex the hip joint, and that's why it is considered as the interior muscle. Active only during the hip flexion, but play a key role in the lumbar spine stability by producing lumbar compression during the hip joint flexion. Some interior shear is also produced when it is activated, which is then resisted by the posterior shear forces produced by the erector spinae deep muscles. So that was the end of the muscles of the lumbar region. Of there will be no such question. If you have any question, then you can contact on my WhatsApp number. You can email me about your query. Thank you so much to all of you.